on this episode of Africa Health Check.
Let there be awareness when it comes to pandemics.
I believe the government should educate the public more on what to do to prevent COVID.
We examine the critical role of effective leadership during a pandemic in Africa.
My team, the whole hospital, we all came together to address this pandemic. The whole country came together. I think what Africa did, what Kenya did, we had fantastic guidelines.
And draw insights from some strong leadership witnessed during the COVID-19 pandemic. The outbreak of COVID-19 and its subsequently being declared a global public health emergency affected many countries worldwide, including African nations. While the pandemic posed significant challenges, Africa witnessed examples of strong leadership that played a crucial role in containing the spread of the virus and saving lives. On today's episode, we will be discussing leadership in the face of a pandemic. I'm your host, Paladi Morokoto, and I welcome you to Africa Health Check. I am joined by our experts, Dr. Marianne Mureithi, the chair in the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we hear from our experts, let us have a look at this week's feature story.
COVID, as you know, bombarded us. I think, as doctors, we're used to seeing a certain number of patients. But when the pandemic hit, we saw so many COVID patients. The difficulty was the large number of critically ill patients requiring critically ill beds. Whether it was inpatient hospital, HDU, high dependency unit, ICU requiring ventilators. And I think the most difficult challenge was to be able to decide which patient you admit and which patient you take to the critical care areas and to what we called in the medical terms triage, who should go where. Everyone wanted the best treatment, everyone wanted to go to the critical areas, but to decide which patient goes where was a very difficult challenge. We also knew what infections involved. We had learned about the SARS covariants. We knew that there had been an outbreak prior in Saudi Arabia, in China. So those are things we were aware of. That helped us understand what a viral infection is. Secondly, it also helped us understand how infectious this is. And the other thing our training did teach us is how to protect ourselves. Now, looking back, I think a lot of doctors and healthcare workers know how to use protective gear, equipment, how infectious an infection can be. But until the pandemic, I think we were the only, we were the most likely expertise that knew how to do this. And we were able to do this. So we were able to teach our healthcare workers how to wear protective gear. We were able to train people to say how infectious this agent is likely to be, where the infection would come from, whether it's aerosol, whether it's through touching or not. If I look at it, I think there were multiple times when patient care came before myself. But I think where I really made a difficult decision was family and home life. There was times where I just didn't go home, or if I went home, I didn't see my family because initial stages of the pandemic, I didn't know how infectious this would be. And being with COVID patients all day long, to go home to my husband, to my children, to my mother-in-law who was elderly, I was worried that I would infect them. So what I agreed is I would go home, eat separately, go to sleep separately so that I wouldn't infect them. Of course, that changed as the pandemic evolved. But for me, that was a really difficult decision. So I put patient care and looking after patients and hospital patients beyond my family. And I think that was the sacrifice I made for my patients. So I think what we did as an infectious disease section is come up with protocols. So first, who do we admit? So there was a time in the first wave where everyone with COVID got admitted. we couldn't continue doing that because we've just got a certain number of beds. If we admitted everybody with COVID, we would not be able to give the really sick patients adequate care. So the first thing was to come up with protocols that looked at how sick a patient was, how much oxygen they required, whether they required oxygen or not, whether they could be managed at home, whether they could be managed in primary care facilities. So the first thing was to come up with protocols, and not just for our hospital, but for the region. And we worked very well with very closely with the Ministry of Health to come up with protocols so that it could be standardized throughout the country and beyond. So that was the first thing. The second thing is who should require what treatment. So whoever needed the treatment as per protocol was treated. Whoever did not get the treatment. And I think that really helped us. So for example, if you were on oxygen, you'd be put on steroids. But if you were not on oxygen, then you did not require steroids. We stopped using antibiotics very early on, only if there was evidence of a superadded bacterial infection. So those are certain examples. So that was managing resources adequately. You know, I think we need to have an essential number of colleagues who can work together. And by colleagues, I don't just mean doctors, I mean nurses, I mean everyone, admin, everybody played their role. So I think to have good relationships with people, to make sure that people feel valued, and to make sure that you can all work together as a team and come together to address any issue that comes. For me, I think my team, and by my team, I mean the whole hospital, we all came together to address this pandemic. The whole country came together. I think what Africa did, what Kenya did, we had fantastic guidelines. We did well. If we compare ourselves to other countries, I think our response was phenomenal. We need to all work together to lead by example, to be there, to be on the front line, and we will overcome whatever comes to us.
Very inspiring indeed, and ushering us into our topic for today, leadership. This is definitely one of my favorite topics, and I know that leadership in any context is very important yet very contentious. So we're talking about leadership in the face of an emergency. Maybe just to lay the foundation, let me start with you, Reverend. What kind of leadership is needed in the face of a pandemic?
Pandemic is a crisis time where people are bewildered, they are fearful, they don't know what the future holds. Even their present conditions might be very difficult. So if leaders are there to solve problems, that is where you see the courage of a leader, and then how relational the leader is with his people. You are looking for a leader that will communicate to the people at the level that they can understand consistently and periodically. You want a leader that will not instill fear into the people, but give hope. You want a leader that is empathetic, understand what the people are going through. Without these, there is nothing that you can do that will impress the people, that will help you lead the people.
Yes. And as a community leader, what would you say, what kind of leader are you?
The pastor is relational. You relate to people. It's a people's work. So when people are in need, they are in pain, that is when you need to show. So naturally, I am bent towards people. To understand them, to know what they are going through. I understand some people will go to the rich in the church, those who are well placed in society. Yes, but no. You are called to help the weak. You are called to help the poor, the sick, and that is the work we do.
So you are a very inclusive leader.
Relational.
Yes, very good and befitting for a pastor. To go to you, Dr. Marianne, if you are asked, what kind of leader are you? How would you describe your leadership style?
Yeah, that's an interesting question because it's hard to self-reflect.
Yes.
And maybe let me answer you by what type of leader I wish I was.
Okay.
And I wish I was a more of a listening leader and listen to the people. I'd want to be an evidence-based leader and look at the evidence in front of me. It's a pandemic. Am I looking at numbers? Am I listening also? A listening leader? Am I listening to my team? So I need to be a team player. And do I have a good kitchen cabinet in terms of advisors? So do I listen to advisors? Do I look at numbers? Am I drama-driven or number-driven? Am I empathetic? Do I go down to the people at their level and empathize? Guys, I know we are locking down. I know your businesses will suffer, but we are in this together. Am I such a leader, or am I a leader who shuts the entire economy and country and goes to my state house and isolate myself? No. I remember watching World War II movies, watching the Queen, the late Queen,
Queen Elizabeth,
out there in the trenches, feeding her people. Yet it's her army that is out there defending the UK or England. And I thought, wow, what a leader, because I would expect myself to be
that kind of
somewhere. Or look at Zelensky, Ukraine. He's leading from the front. And many people at the beginning expected him to run away and seek asylum. But he stayed put. So can you imagine how people in Ukraine are in terms of resilience? So that's the type of leader I wish to be.
Yes, that's wonderful. That's wonderful, and I certainly hope you're working towards that every single day in your profession, in your personal life, because it's not a once-off thing. It's a continuous journey of improvement, learning and learning. So we're talking about leadership in the face of a pandemic, and one of the most important things about leadership in a crisis is the ability to be decisive, to make decisions, to make sure that you get people to work not only for you, but with you, and get that buy-in, and also ensure proper management of finances. So the last 3 years, many of our leaders actually faced a very big challenge, and for many countries, especially the peaceful ones that have not had, terror attacks or wars and all of that, this was a very big test, COVID-19. How would you grade our leaders in Africa?
I can only speak for me, for my leader.
Yes.
Because I have not really studied and known how other leaders perform.
Yes.
But I think our leader, the present president, Nana Akufo-Addo, he did an excellent job because I believe in Africa, he was one of the few presidents who came out boldly after hearing all that was happening in Italy, in Spain, in the UK, and the news that Africa will be decimated and things like. He came up one day at in a national broadcast and instituted, shut down the land borders, declared, that this is on us. And all the things and he did it carefully. He had consulted the science people, the Ghana Health Service, the Ministry of Health. He had had collaboration with the religious leaders and with the chiefs before the announcement. And he put such measures in place that you knew he was doing it's not just a blanket lock down everybody else. No, he studied the ground, and said Accra, rather, is the capital, and the other capital, Kumasi, those demarcations will go under lockdown. Because virtually the greater part of the country, so that decisive, and from, like Dr. Miriam said, from a knowledge base, he's just not throwing things out there, but he's receiving instructions from people on the ground, he testing them, and coming to the people. The thing that won my heart was that he identified very vulnerable people, poor people, street people, and mandated to use government's money to feed them, to take care of them. I think it was very good.
Okay,
and let's take it. He was the first leader in Africa to boldly order or receive the COVAX vaccine, AstraZeneca. That was our president. I think it was just a bold step for a leader to do that.
So he actually showed very strong, very decisive and impactful leadership where, the center of your decision making is the best interest of your people.
Yes.
For you, Dr. Marianne, how would you grade our leaders in the face of COVID response?
Yes, good question, because for me, I think being a teacher, I can have 2 marking schemes. And the 2 marking schemes is who was a good leader and who was not a very good leader.
Yes.
And very good example is what Reverend has mentioned. President Adolf of Ghana led from the front. He listened. He was evidence-based. He acted very quickly, very decisively.
Yes.
And then we tell you that saved lives in Ghana. On the other side of the coin, we saw leaders, and again, maybe this is not a forum to mention names, who are very slow to respond, even start questioning the scientists. Like, oh, that is fake news. Or that does not exist. Can we continue our lives? Why should we wear masks? We're not going to wear masks. And then we saw the numbers rising. We saw their hospitals totally full. I remember even watching news where they even had to set up temporary hospitals in the car park because of what? Poor leadership. So we have 2 sides of the coin.
That's right.
A good leader, decisive, and there was evidence to show that the numbers were down. The populations listened because this president was not being swayed, like a good example, by conspiracy theories. He was following the science, and the curve went down. Yet the president, who was not following the science, was even questioning the science. So you can imagine us in the lab as scientists, our hands were always like, oh, what is he even talking about? We saw what the consequences of that.
And many times, as a leader, it's just about listening to people around you. I think one of the most saddening things is when, you've entrusted people the responsibility to give you counsel, to advise you, to guide you, and because you believe they are experts, that are well-learned, and you still don't want to listen to them. So what is the point of having all of those people around you who are supposed to help you to make informed decisions,
Yes, and it was very painful the other day. I think this was all over the news on CNN, where the leading scientist in the US was from March to the Senate, or is it the Congress, and has been questioned by senators. Why did you push for the lockdown? You affected our economy. And the scientist there was really trying to defend his stand with science, but the politicians were having none of it. And we were very saddened because subsequently scientific communities, scientific journals started writing editorial pieces defending that leading scientist, because we really have to defend data, we have to defend evidence, because this is not the only pandemic.
Absolutely.
Yes, so we have to
but
start
also
with science.
on that, Dr. Marianne, isn't that actually how it all started with COVID-19? As scientists, I think there's been a lot of reports around how there was a scientist in China who had been trying to get the attention of the decision makers or the key stakeholders the previous year, is it in December, and trying to sensitize them about this before it became a public health emergency. But again, those with the helm of power in decision making did not take seriously his awareness raising.
And that was pretty sad. I was watching a scientist from Europe, someone I really respect, and he was saying for the first time he's hired security for his family. Because again, he was advocating for the simple measures: wear a mask, social distance, lockdown. But this population where he serves were not listening to him. But then when they look back to Africa, kudos to Africa and our leaders and our people. People listened.
No, I think to a large extent, honestly, this is one of those scenarios where we need to give ourselves a pat on the back. Our response, our leadership generally, of course, here and there, there were some deficits, but I think generally the response from our leaders, from the community, was really remarkable. When we come back, I want us now to take it a little bit step further. What more can be done to enhance our leadership, to support leadership efforts and ensure that we actually have competent leaders who can push us forward into achieving sustainable health outcomes? But for now, we're going for a quick break where we'll hear what the people on the streets of Africa had to say. Stay tuned.
When it comes to health for mothers in Africa, we are still vulnerable, we are still prone, especially in rural areas. We still have people, especially mothers, dying whilst giving life to a human being. I feel there's quite a lot that can be done. Sensitization when it comes to parental care, sensitization when it comes to childbirth, sensitization in rural areas that walk long distances to access medicine or services.
Serikali na jamii bila shaka zote zinauelewa cha kufanya katika huduma za afya. Kinachotakiwa tu ni namna ya kuwajibika vizuri na vile ninavyopaswa.
There should be centers that will be developed by the government so that the people can be taught this kind of the transmissions of these diseases in our own family, which are the communicable diseases that can actually spread within a shorter time in our community. So that ignorance is a bigger problem that we are having in our society, especially to those remote areas. People do not know anything. They don't even know what kind of the different types of communicable diseases we have in our own localities or in our own areas.
Welcome back to Africa Health Check. We are still talking about leadership in the face of a pandemic, and going back to Reverend and Dr. Mary, and just from your experiences as a leader, as a community influencer during the pandemic, what would you say are some of the key lessons that you learned as a leader, and this could be at a personal level, lessons that you had to experience and discover for yourself, or maybe through watching other leaders and you pick up some of the lessons, you say, okay, I'm realizing that this is what is needed for a leader, or more of this could have been done in responding to COVID-19. Should we start with you, Reverend?
Yes, I would say that you must lead by example. Here is a situation where people are hesitant about wearing the nose masks or face masks, hesitant about taking the vaccine, hesitant about so many things. Fear for the future, all misinformation and things like that. What does it do? People are looking at you. What you do is what they will follow. And once again, as Africans, we community leaders have such power of followership. So in my particular case, I started wearing the face mask in preaching. I made sure that people distance themselves, wash your hands. When I took the vaccine, I told them of the church that yes, I've taken the vaccine, all the two. And that became an encouragement to the church members.
Yes.
That if this man, being a pharmacist and a senior pastor, has gone ahead to do these things, then I think there is nothing to fear.
Absolutely.
So I think that is what most of our leaders did, in plain view, taking the shot, cameras on him as a way of encouraging the faint-hearted, the fearful, to be able to follow suit. And that is one of the things that most of our leaders did. And that got the job done.
Exemplary. I even remember some leaders as well. They would go on TV. They were showing that they're doing some home exercises as a way of encouraging people. Do you remember that?
Oh yeah, and I was inspired because that certain leader is old. Okay,
yes, I think the President Museveni. Yes, he was exercising, and that was really
push-up.
It was really encouraging. I think that was really, like you're saying, it's powerful. There's a difference between telling people to do something, you actually doing it as a leader. It's a game changer, So I think that was really great. But talking about that and maybe just putting in something a little bit controversial here, I think one thing also that was quite a big lesson, and a shocker was that, COVID is something that did not discriminate. All of us were affected by COVID, rich, poor, young and old. And, normally when it comes to health, we have this thing in Africa where we say those who are rich, and including our leaders because they are privileged, they tend to fly out of the continent or fly elsewhere to access better health services. But for the first time, this was something that the whole world was affected by. We are all locked down. There was no chance for you to fly elsewhere for better medical health services. So we're all in the same boat. And I think that's one of the things that, made communities feel like, leaders are actually feeling that pain, their struggle, the pinch, because we were all literally on the same boat.
And I like that in a way. Okay, it was pretty sad.
Yes.
But on the other hand, I remember in Kenya just saying, now it's the first time our leaders will know where their local hospitals are.
Yes.
They'll know what the needs of their local hospitals. And then from there, build up better local healthcare systems.
Yes,
So it was a big lesson learned right from the top leaders to the local leaders. And again, I'm hoping that we've learned, now I see we have oxygen plants.
Yes.
We have people who are now concentrating in making oxygen tanks, syringes. Again, now we're having people thinking of let's make more syringes or more PPE for healthcare providers.
Yes.
So in case another pandemic comes, we are readily stocked. So I'm very excited about the future.
Absolutely.
And also very saddened of the past, people that lost their lives, sacrificed so much, lost their businesses. But in all that, there's a lot of hope.
Yes, absolutely. I think, like you're saying, a lot of the gaps were identified, and I guess, in anything, we have to look what is the good thing that came out of that, So for many of our leaders, they were really exposed to the reality of how our public health system is. And yes, but of course, it doesn't mean that all of them will after the pandemic, rectify those deficits within our system. But at least we know they were exposed to that. They saw the reality. They felt even the pinch. I even remember at some point, you couldn't even differentiate between a public and a private hospital, because all of them were overwhelmed and they had to take up patients regardless of where you're coming from, your medical aid or cover or anything of that sort. So I think those are some of the good highlights that came out of the lessons from there. But before we wrap up, I want you to tell me, who was your most outstanding leader in the face of COVID-19? And it doesn't have to be an African leader. It would be good if it's somebody from Africa. After all is done, who would you say was the most outstanding president in the face of COVID-19? Let's start with Reverend.
I'll hesitate to mention names.
Okay.
Yes. But I learned the New Zealand Prime Minister
Jacinda
was excellent.
Yes.
In what she did during the time, and then some African leaders as well. I'm not too sure about Europe, but I think most of them were empathetic, collaborative. They fed their people with the right information, led them in the right direction. And to me, that is the marks of a good leader. Yeah. If you were there for your people, if you were feed them with information consistently, if you are listening to science and to I think you qualified to be called a good leader.
Okay. No, that's good. Thank you very much for that. And for you, Dr. Marian, I mean, we shouldn't always talk about the bad. We need to also celebrate the good. And this is the chance. This is the chance to say their name, make sure they are known, and history also gets to recognize them. So who was your star leader during the COVID-19 response?
For me, there are many. And most of them, when I look back, majority of them are from Africa.
Yes.
From the president of Ghana, who led the example.
Yes.
Look at Yoweri Museveni. He was very strict, but I believe that helped the Ugandan COVID curve come down.
Yes.
I have to really give a big kudos to our former president, Uhuru Kenyatta. His message was clear, concise. Every day at 4 p.m., he had a report just to assure the nation they're doing something. He had a very good committee that is made up of scientists, people that I know. So I felt that was, wow, that's a leader who is listening. You go to South Africa, the leadership there was also amazing. I would like to hear from you. How was it in Botswana?
From Botswana was actually really, really amazing. I think Botswana is probably among the few countries, for example, that had a very strong social services sector come in as well. People were receiving food baskets during the first lockdown. You know, we had so many organizations setting up ad hoc centers for GBV survivors. We had churches now being used as GBV centers. We had people donating, you know, whether it's food, sanitary pads, free counseling services, a lot of free counseling services available during COVID time. Private sector also came through. There were so many donations to the coffers of the COVID-19 response. So I think in my country, the leadership also really, really showed some really strong competence, you know, strong leadership, people-centric leadership, and the community as well, private sector, individuals in their own spheres of influence also really contributed significantly to the response. So I think that's a really good thing, because I know of countries in Africa, like Malawi, for example, that couldn't go on lockdown because, you know, the poverty there is really high. And when the government first imposed lockdown, the people went on the street to march and protest. And they said, we can't go on lockdown because we need to feed ourselves. We need to go out and look for food and fend for our families, you know. So I think it was the High Court that overturned the lockdown ruling. So that shows you that, you know, there's some serious social services deficits in our countries. But in my country, very strong social service net. Yeah,
I think you make mention of people donating, you know, to that. That's a sign of good leadership, because I think that your leaders spoke to the hearts of people.
And appealed to them.
That is what our leader did in Ghana. And there was overwhelming response. People, NGOs, all kinds of people donating and giving so much money and goods for the care of the needy.
Yes, absolutely. And, you know, just as we end off on a positive note, I think we also need to send a shout out to countries that have made positive strides in terms of vaccine manufacturing and production. And we're talking Senegal, Kenya, Egypt, Morocco, South Africa, Uganda, and most recently Rwanda are countries that have made a certain progress in terms of investing in vaccine manufacturing. And again, that is a reflection of good leadership, and not just at the highest level, but at all levels, because, you know, there are different levels of leaders. But if leaders work together, if leaders deliver, and if leaders are competent, lives are saved and livelihoods are transformed. Thank you very much. What a very inspiring episode that we've had. And I hope that for you, it has also challenged you to stand up and take up your position in your community and be a leader and an agent of change. But before we wrap up the show today, I would like us to take a look at our African health champion for this episode. Coming from Kenya, we get to highlight a former cabinet secretary whose leadership in the pandemic was exemplary. Let's have a look.
Mutahi Kagwe, the former health cabinet secretary of Kenya, emerged as an Africa health champion during the pandemic through his exceptional leadership. Facing the uncertainties of the coronavirus, Kagwe exhibited dedication and expertise in managing the crisis, making him a crucial figure in Kenya's fight against COVID-19. His daily briefings, which informed the nation about measures to combat the virus, demonstrated his commitment to transparency and public health. Kagwe's ability to communicate effectively with the public, provide updates on the patient numbers, and even share both hopeful and grim news showcased his resilience and empathetic leadership style. His role extended beyond communication as he implemented aggressive measures recommended by the World Health Organization to identify, isolate, test, treat, and trace COVID-19 cases. This proactive approach was crucial in containing the virus's spread within the country.
And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight on the show. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is @Africa Health Check. Until we meet again, same time, same place, same date, remember the future is Africa, the future is today.